A Proof of Snakebite by Muhammad Sariul Ashraf. Before we are going into more further, first we need to learn how to differentiate between venomous and non-venomous snake. Venomous snake usually have characteristics such as triangular head, elliptical pupil, head sensing pit, and also retractable fangs. Retractable fangs is the most important characteristic. Meanwhile, for the non-venomous snake, usually characterized by rounded head, round pupil, and also absence of fangs. Did you know there is approximately more than 140 species of snake in Asia? Most of the snakes are harmless to human beings and may consider as non-venomous. Only snakes which have the venom glands adapt to carry the fangs to inject the venom are considered as venomous. However, in Malaysia, there are only 70 species of snake that consider as venomous and considered as dangerous to man. So today, we are going to learn the top common causes of the venomous snake bite in our emergency department. So approximately there are only 4, which is pit viper under family of Viperidae, cobra under family of Elapidae, and coral snake under family of Elapidae, and lastly the sea snake under family of Hydropteridae. Okay, let's go into the picture of snake bite. So for the generally, patient may present with nausea, vomiting, malaise, and abdominal pain, and weakness, drowsiness, and also protection. However, all of these is non-specific. Regarding the local site of the snake bite is there is presented with probably severe persistent pain, intense swelling of the limbs, blister, and also slough and necrosis. This is more specific to certain type of venom. For the elapid, the most common presented is local necrosis, respiratory paralysis, and also cardiac arrhythmia. Meanwhile, for the hydrophidic venom, the patient may present with respiratory paralysis, myonecrosis, hyperkalemia, and also acute renal failure. Meanwhile, for the crotali venom, may present with local edema and necrosis, hemorrhage, DIVC. So this is a table to help doctor to differentiate. The sign is for the cobra. Let's say if cobra snake bite may present with severe pain at the bite side, orgasmic swelling, tissue necrosis, and blister. However, this is compared with sea snake, there is none of this is presented. Okay, so for the investigation, we need to do a full blood count. If the expected result is platelet count may be decreased. If there is a bleeding, the expected for hemoglobin will be dropped. Next is for the coagulation profile. The expected result for APTT, PT, and INR would be increased. And for the coagulation profile must be repeated for 6 hourly. Next is renal profile. We need to check for serum creatinine if necessary to rule out any renal failure, and also to detect any electrolyte imbalance. And we also need to check for the hyperkalemia. Next, for the creatine kinase, is for early detection of rhabdomyolysis and also requires serial monitoring. Next is urinalysis. Urinalysis is to assess for any myoglobinuria, hematuria, and also proteinuria. Next, for the liver function test, we need to do if we suspect any liver function, any mild hepatic dysfunction. And next is ECG is to detect any arrhythmia, especially if the snake bite is from Naja species. And next, we also need to do APG to monitor and assess respiratory function, and also to detect any metabolic acidosis in renal failure. Next is for the management. For the generally, we are trying to resuscitation and monitor, and patients must be located in red triage zone. And we also need to take However, I try to summarize everything. The summarize is patient must be able to describe the snake. If patient cannot describe the snake, there must be a picture. Or if there's no picture, at least we need to know the location. Is it the snake is from water or from the tree or even from the land. Next, we need to inspect the bite because we need to know is it there is a presence of retractable fang or not. For the first aid management, 2 out of 3 victims are injected with very little or no venom. So immobilization of the bitten limb with a splint and sling, and do not bite or also not cut or squeeze it, and we must rapid transfer to the hospital. So this is one more time for the general measure is we need to APC, airway, breathing and circulation, and we need to keep on monitor the degree of the severity and extent.